I want to thank the organizers for giving me this opportunity. I'll be discussing about this recently published article which was published in Nature Communications. The topic is Gilteritinib overcomes lorlatinib resistance in ALK-rearranged cancer. We know that ALK rearrangement is seen in 3 to 5% of patients with NSCLC, and we have different TKIs available. Up to 3 generations of TKIs are approved for the treatment. Post use of these ALK TKIs, we see various mutations which can be ALK dependent as well as ALK independent. Now, lorlatinib, with coming into the clinical use, we are seeing various compound mutations, some of which can be actually resistant to all available ALK TKIs. So, in the quest for finding any active agents against such resistant mutations, researchers have probably come up with an answer, that is gilteritinib. We know that gilteritinib is a multi-kinase inhibitor which is approved for use in AML FLT3 relapsed refractory patients. So what researchers did that using various cell lines and mouse xenograft models, they found the anti-tumor efficacy of gilteritinib in ALK-rearranged resistant cancers. So I'll be discussing about these various steps. So first, what they did, they took BAF3 cells. These are actually murine bone marrow cells, which were expressing ALK mutations. Some of these were having.
Sir, slides are not moving, sir. It's stuck
Not
in the
moving.
title slide.
So can you share the slides from your end? If
Yes,
there
sir.
is
Yes,
problem.
sir. We're sharing.
Next, please. Next. So what researchers did, they took BAF3 murine bone marrow cells, which were expressing ALK mutations, and these were exposed to the 90 inhibitor library, various multi-kinase inhibitor, and they found that gilteritinib was the only agent which showed activity against wild-type ALK mutant resistant as well as compound ALK resistant tumor cells. Next. Next, in the next step, they expose these gilteritinib to human cell lines as well, and it showed inhibition of phosphorylation as well as inhibition of downstream pathways. Next, so there is definite on-target activity. Next, please. Now, in the next step, they showed whether it shows anti-tumor activity. Next, and they expose the EML4 ALK fusion positive non-small cell lung cancer cells to various ALK TKIs, and you can see here the gilteritinib shows the least IC50 value for these cells. Next, these were actually the human cell primary cancer cells. Next, next, and in the mouse xenograft model also we can see here the anti-tumor activity of gilteritinib. The black curve is for the control, the red curve is for the gilteritinib. Next. So there is definite potent anti-tumor activity. Next. Now coming to the question of resistant mutants, the we know that after the use of first and second generation ALK TKIs, various simple mutations develop, and gilteritinib showed activity against most of these mutations except for these two. Next, these are the resistant, and the gilteritinib was also active against the compound mutations. Next. This mouse xenograft model shows activity of gilteritinib against the compound mutations as well. Next, next, next. Now, the question of bypass pathways, we know that the post-use of ALK TKIs, patient develop activation of various pathways, and here the efficacy of gilteritinib was shown in cell lines which were having overexpression of AXL pathway. But in case of KRAS pathway, next, KRAS pathway as well as EGFR, it was not active against as a single agent, but in combination with either KRAS inhibitor, that is sotorasib, or EGFR inhibitor, it was showing anti-tumor efficacy. Next, please. Next, we know that the ALK TKIs show activity against ROS1 and anti-RK1 rearranged tumors as well because of similarity between the binding site. Here, Gilteritinib also showed activity against ROS1 and anti-RK1 rearranged cancers. Next please. But it was not active against EGFR and KRAS mutations. Next. So to conclude, Gilteritinib displayed potent in vitro and in vivo activity against ALK-TKI resistant simple and compound mutations. It also inhibited ROS1 and anti-RK1 kinase activity. So it can be one of the drug useful for next line of ALK-rearranged cancers, although further studies are warranted. Thank you.
Thank you, sir.